Good morning, everyone, and thank you for joining us. My name is Stacy Varghese, and I'm the Director of Leadership Annual Giving and Engagement at St. John's University. Today, we have Dr. Tracy Gangi, who will discuss new frontiers in mental health. Some housekeeping rules before we begin. If you have a question, please submit it in the chat section, and they will be answered after the presentation. Now, I'm excited to introduce our speaker. Dr. Gangi is a licensed clinical psychologist with more than 20 years of experience, 30 years of experience rather, providing compassionate, evidence-based care. She specializes in ADHD, depression, and anxiety, and is certified in Ketamine-Assisted Psychotherapy. Dr. Gangi works with adolescents 13 and over, adults, and seniors, offering a comprehensive assessment, individualized therapy, and trauma-informed treatment. Known for her engaging and efficient approach, she empowers clients to overcome challenges and achieve their full potential. Welcome, Dr. Gangi. I will hand the webinar controls over to you now.
Thank you, Stacy. Appreciate it. And I want to thank everyone for joining us, students, alumni, faculty. I really appreciate you being here, and it means a great deal for me to be here with you. As you can see, I'm a longtime alumni of St. John's, and it's especially meaningful for me to be here with you, not just professionally, because St. John's has really shaped me in that way, but also personally. I really have a big place in my heart for St. John's. And I want to join us into this conversation about mental health. And mental health matters more than ever. There's so much stress and anxiety and depression, and it's overwhelming to so many people. So these are not just rare experiences that we talk about. These are human experiences. It happens regardless of socioeconomic background, ethnicity. It's across the board. So talking openly about mental health is not a sign of weakness. It's a sign of care, responsibility, and compassion. My hope here today with this webinar is to simply offer understanding, some clarity, some hope, to help normalize these conversations and to share how mental health is evolving to better support the people that need it most. So let's begin. So why are we talking about new mental health treatments? Well, we know that anxiety and depression are incredibly common, unfortunately. So roughly 1 in 5 adults in the United States each year struggles with depression or anxiety, and millions of people worldwide are affected. So as I noted before, this is not rare, this is human. Many people do exactly what they're supposed to do. They seek therapy. They try evidence-based approaches like cognitive behavioral therapy. They take medication, and they genuinely put in the work. And for many people, that does help. But the reality is that less than half of people achieve full response or remission. And some people continue to struggle even after they do everything right. So some estimates also suggest that 10 to 30% of people with major depression don't respond adequately to medication alone. And others remain what we call treatment resistant despite multiple approaches. So this is why we need new and adjunctive treatments, and we're exploring all of them, not because the traditional therapies are wrong, but because they're not always sufficient for every nervous system, every history, and every kind of suffering. Needing new options is not a failure. It doesn't mean that someone didn't try hard enough. It means that their system needs a different kind of support. So these are the things that drive innovation in mental health care. And that's why approaches like ketamine-assisted psychotherapy are being thoughtfully and carefully explored. So we'll talk a little bit about trauma here. And it's helpful to understand that not all trauma looks the same to every nervous system. So I'll walk us through a little bit of PTSD versus complex PTSD. PTSD often develops after a specific identifiable event. something that's overwhelming that the brain and body couldn't fully process at the time. Whereas complex PTSD, or is also called CPTSD, it tends to develop when trauma happens repeatedly or over long periods, especially when a person didn't have safety, support, or a way to escape, much as children don't have that ability. So in addition to fear-based symptoms, people with CPTSD often struggle with shame, difficulty of trusting others, emotional overwhelm, or a sense that something is just wrong with them. These are adaptive nervous system responses to overwhelming experiences. And this distinction matters because treatments that only target fear or memories don't always reach the deeper emotional and the identity wounds that are seen in complex trauma, which is why newer approaches, including ketamine-assisted psychotherapy, are being explored. Okay, so what is ketamine-assisted psychotherapy? So we also call it CAP. It combines the medical use of ketamine with structured psychotherapy. So in this model, ketamine-assisted psychotherapy, ketamine is not used as a standalone medication. Instead, it's used alongside therapy to help people access thoughts, emotions, or perspectives that may be difficult to reach through traditional therapy alone. So ketamine can temporarily soften rigid thought patterns and reduce emotional overwhelm, which then creates a window where deeper therapeutic work becomes possible. So the medicine may open that window, but psychotherapy is what helps people understand, process, and integrate what emerges. So this process is guided and intentional. Clients prepare ahead of time, work with a trained therapist during the session, and then participate in integration afterward, where insights are explored and connected to everyday life. This is very different from recreational or unsupervised use. In ethical clinical settings, dosing is controlled, medical factors are considered, and clients are carefully supported throughout the entire experience. So the focus is not escape or intoxication, but it's healing and meaning making, helping people shift long-standing patterns and engage more deeply in their therapeutic work. So I'll talk a little bit about my training. It's a structured clinical approach that requires specialized training, careful screening, and professional therapeutic support. My own training in psychedelic-assisted psychotherapy was extensive and provided by experienced clinicians and researchers in the field. The training included preparation, medicine sessions, and integration. So you might hear of some settings where ketamine may be administered medically without the psychotherapy component. For example, in infusion clinics, where the focus is primarily on administering ketamine through an IV, and that's it. While those approaches may provide symptom relief for some individuals, many clinicians in the field, myself included, believe that combining ketamine with psychotherapy and structured integration offers the most comprehensive and therapeutically meaningful approach. So how is ketamine administered? Lots of different ways. So one form is called Spravato, and that is a nasal spray version of a ketamine-related compound called esketamine. Spravato is FDA approved for treatment-resistant depression, and it's administered in certified medical clinics under supervision. In addition to Spravato, ketamine itself is commonly used off-label in mental health treatment. Off-label simply means the medication is FDA approved for one purpose. So in this case, ketamine is approved for anesthetic purposes as an anesthesia, but physicians are allowed to prescribe it for other evidence-supported uses. So these off-label methods can include intravenous infusions, intramuscular injections, oral lozenges or troches, and rapidly dissolving tablets. Now, in the clinical setting where I work, I collaborate closely with a psychiatrist, and we primarily use troches, intramuscular administration, and dissolving tablets, depending on what is most appropriate for the patient and the therapeutic setting. I've not used Spravato with a client, but the psychiatrist I do work with offers this sometimes with clients that would like to do periodic boosters or maintenance of the ketamine session. Sometimes that's once per month. So let's talk a little bit about ketamine itself. So on this slide, you're seeing the chemical structure of ketamine, which I've included intentionally to ground this conversation in science. This is a real, well-studied medical compound. It's not something new or experimental. Ketamine was first developed in the 1960s, and it's been used safely for decades as an FDA-approved anesthetic, particularly in emergency medicine, surgery, and pediatrics. It's also been widely used in battlefield medicine because it preserves breathing and cardiovascular stability. So, from a medical standpoint, ketamine has a long and well-established safety history when it's used appropriately. So, what surprised researchers and eventually changed the mental health landscape was that clinicians began noticing something unexpected. Patients who received ketamine for anesthesia or pain management sometimes reported rapid improvements in mood, even when they had long histories of depression that hadn't responded well to traditional treatments. So then in the late 1990s and early 2000s, there was approval to do more research on this effect, and they started studying it more closely. And by the early 2000s, ketamine was being investigated and then used off-label for treatment-resistant depression because it appeared to work differently than standard antidepressants. So instead of taking weeks or months, some people experienced relief much more quickly. Since then, research has expanded to include anxiety, trauma-related conditions, and particularly when ketamine is paired with psychotherapy. So this isn't a new substance, it's a new understanding of how an existing medicine can support healing when it's used thoughtfully and ethically. So what happens in the brain? So when we talk about what ketamine does in the brain, one helpful concept is something called the default mode network, or DMN. So the DMN is a network of brain regions that's active when we're thinking about ourselves, whether it's our past or our worries or our mistakes or our fears. It's the part of the brain that's often responsible for ruminations and getting stuck in negative self-focused loops. In conditions like depression, in anxiety, in OCD, in trauma, the default mode network can become overactive and rigid, which then keeps people trapped in that same thought pattern and the emotional patterns that come with it. Ketamine and other psychedelic medicines appear to temporarily quiet this network, which gives the brain a break from its usual loops. That's relieving on multiple levels. So in addition, we now understand that ketamine and these other psychedelic medicines can temporarily increase neuroplasticity in the brain, which means that the brain becomes more flexible and open to change. It actually grows the dendrites at the ends of your neurons. And when you've got that growth, that dendritic growth, this is where the brain becomes more flexible, more open to change, and out of those rigid loops and ruts that we can get into when there's rumination. So, and this is where psychotherapy is essential. It not only helps make sense of what emerges in the ketamine session, but it can also support the lasting changes that can happen after the neuroplastic window closes. So why talking alone isn't always enough? Talk therapy is incredibly valuable, and for many people, it's life changing. But one reason some people continue to struggle is that knowing something cognitively and rationally doesn't always translate into changing how we feel. So someone can fully understand why their anxiety or depression is about, where it comes from, but still feel overwhelmed by it. And that's because stress and trauma don't only live in our thoughts. They live in the body and in the nervous system. And they've done lots of studies on, and adverse childhood events studies, or ACE. You might have heard people talk about the ACE studies or ACE scores. They have found that even pre-verbal traumas can be stuck in the nervous system. So you might not have a cognitive memory of it, but your nervous system still has strong reactions. So stress and trauma don't only live in our thoughts, they also live in our body and in our nervous system. And these patterns don't develop automatically. They don't always, but they do often occur long before we have words for these things in life, and they don't always respond to insight alone. So ketamine-assisted psychotherapy can support that deeper emotional processing, which can make it easier to feel emotions, access memories, and engage in therapy without becoming overwhelmed. Because sometimes in trauma work, things can come up, it can get overwhelming, but under these medicines, the fear response is quieted, and there is more ability for the person to interact with those traumas. So in psychedelic work, we often refer to something called the inner healing intelligence. And that simply means that people already carry an innate capacity for insight and healing within them. Our roles as therapists isn't to direct your experience, but to create a safe environment where that internal healing process can unfold. So a lot of people want to know, what does a ketamine session feel like? And it really does vary. Some people describe the experience as deeply calming or spacious, as if the volume of their usual thoughts have been turned down. Others feel more emotional or reflective, with memories, images, or insights coming up in a gentle way. Some people experience mild dissociative sensations, such as feeling a little detached from their body, time slowing down, or observing thoughts from a distance. But importantly, these effects are expected and they are temporary, and they are always discussed beforehand. And throughout the session, people are always supported. So a trained therapist is present the entire time. And again, this is the ketamine-assisted psychotherapy that I and my colleague do. In certain clinics, a therapist is not always present the entire time, but in the way that we do it, I'm with the client the whole time and monitoring their safety. There's a medical personnel on staff if anything were to come up. And I offer grounding if needed, if they're feeling really disoriented. But they're never left alone and never forced to engage with anything that they're not ready for. So the goal is not to have a particular kind of experience. It's to create a safe, supported space where whatever arises can be met with curiosity and care and therapeutic guidance. So in this work, people sometimes use the word noetic. And what that means is that it feels as though what you experienced in the psychedelic journey was deeply true. And another word that's often used is ineffable, meaning that it's hard to put into words what you experienced, because these experiences often happen beyond language, even though they can still be very meaningful, but you might not have the language to describe it. So who might be a good candidate for ketamine-assisted psychotherapy and who might not be a candidate? So this may be helpful for people that are struggling with depression, anxiety, trauma, or even a persistent feeling of being stuck in life, especially when traditional treatments haven't brought enough relief for them. Um, Many people often feel trapped in the same emotional or mental patterns, even though they have deep insight or they've really worked hard or they've done years of therapy. And ketamine and psychedelic medicines can sometimes help create movement where things have felt stuck or frozen. At the same time, though, it's very important to say that ketamine assisted psychotherapy is not appropriate for everyone. So, people with certain conditions, such as active psychosis, a history of uncontrolled mania, or some severe medical conditions. And just a quick note on psychosis or mania. Um, if if the person already is having a hard time staying connected to reality, these medicines are not going to help ground them in reality. So full psychiatric histories are taken to ensure that the person has a good, solid, grip on reality, and that there haven't been past instances of that not being the case. Because the ketamine or other psychedelic medicines could worsen these symptoms, or for other medical conditions, it could pose a medical risk. So people with active substance misuse may also not be good candidates without additional supports in place. There are specialized therapists and psychiatrists and other clinicians that work specifically with substance abuse candidates in different ways, but that's beyond the scope of this webinar. And so here we're making sure that the goal is not to offer ketamine to as many people as possible, but to make sure we're offering it to the right people in the right way and at the right time. So any responsible conversation about ketamine-assisted psychotherapy has to include safety, support, and ethics, because these are non-negotiables, especially in the setting that I work in. So first is the medical screening. And before anyone participates in CAP, there's a thorough review of medical history. Your doctors are consulted with. We go over medications and your mental health background. And this helps determine whether ketamine is an appropriate and safe medicine for this individual. Second is informed consent. Clients are educated in advance about what ketamine is, what it isn't. We always say that this is not a silver bullet. It's not going to be a miracle cure, but it is going to give you deeper insight into yourself and create more space for you to integrate some of those past mental patterns that you were stuck with, and really helps to relieve you of many, if not all of them. But again, not a cure. And nothing is rushed through this process. People have the opportunity to ask questions and change their minds at any point. And then finally, professional therapeutic care. As I've mentioned several times, ketamine-assisted psychotherapy is provided, especially where I work, by trained clinicians within their scope of practice. And again, never left alone. And integration therapy afterward is an essential part of ethical care. When these elements are in place, ketamine is not being used casually, it's being used thoughtfully, responsibly, and in the service of healing. So one of the most common questions people ask is, how long do the benefits of ketamine-assisted psychotherapy actually last? So we know through the research that ketamine can produce rapid antidepressant effects, sometimes within hours or within the first day after treatment. And I know in ER settings, they'll use that to help people coming in with intense suicidal thoughts and planning behavior. And it can be very effective in the ERs for that. For a single treatment of ketamine, that relief may last several days, sometimes to a couple of weeks. However, when ketamine is delivered in a series of sessions, and this was based on the research that they did, that the improvements that are experienced can last weeks or even months, or sometimes even beyond that. And in the clinic that I work at, we do a series of 6 sessions, sometimes 8, depending on the severity and longevity of the symptoms that the person has been struggling with and the severity of their symptoms. So, as we discussed earlier, ketamine temporarily increases neuroplasticity in the brain, the growing of the dendrites in the brain, and that creates that window of flexibility where the therapy can be much more effective. So the psychotherapy that follows is where those experiences really start to take shape. This is where clients reflect on what they felt or noticed during the session. They explore what it might mean in their lives, how it might change their relationships, and the patterns that they've been struggling with. And this is really where the insight begins to turn into understanding. And integration then focuses on bringing those insights into everyday life. So how do we do that? Through reflection, through conversations in therapy, and then gradual changes in behavior. So without integration, even the most powerful psychedelic experience can fade. But when those insights are supported through ongoing therapy and intentional life changes, the benefits can last much longer. So when we look at the real world outcomes of ketamine-assisted psychotherapy, many people report meaningful relief from their symptoms, even when they've struggled for years. That relief doesn't always mean that everything disappears. And like I said, it's not a cure, but it often means that suffering feels more manageable and less consuming. And the greater psychological flexibility, getting out of those ruts of thinking, not so stuck in the same reactions, the same fear loops, and the same harsh judgments. There's much more room to pause and reflect and then respond differently in your life. And as I've said, there's improved engagement in therapy at that time. And clients are much more open, more emotionally accessible, more able to do the deeper work that leads to the lasting changes. I know in my own clinical practice, I've had clients follow up a year later expressing their genuine satisfaction with their ketamine-assisted psychotherapy experiences. They describe gratitude, not just for the symptom relief, but for the deeper healing and insight they feel it helped unlock for them. So for many people, it didn't just change how they felt, it really changed in positive ways how they viewed themselves, with much more self-compassion and much more self-awareness. So when we look at the future of mental health care, it's becoming more clear that it's getting more personalized, it's getting more integrative and more human. And so more personalized means we're moving away from the one size fits all, everyone goes on an SSRI kind of thing, and toward approaches that recognize each person's history, their nervous system, and their own lived experiences. More integrative means combining lots of tools, medicine, psychotherapy, neuroscience, and the relational care. So more human means that we're remembering that healing doesn't happen through these strict mental health treatment plans alone. It happens when there's a feeling of safety, when there's a relationship, when there's a feeling of dignity and respect, and when there is not only self-compassion, but compassion for the client. And I believe that the goal of healing is to use these tools to help peel off the layers of symptoms that have been burdening people, peel off the trauma, peel off the grief and pain, so that we can see the real and true essence of who you are underneath all of that. Ketamine-assisted psychotherapy is just one example of this broader shift in mental health care. It's not a replacement for traditional care, but it's as part of a more thoughtful, flexible, and humane mental health system. If there's anything that I hope you take away from today, it's this. It's that help is expanding. Mental health care is growing, it's evolving, and it's offering more options than ever before for people that are struggling. You are not broken. Depression, anxiety, trauma, feeling stuck are not personal failures. They are human nervous systems doing their best to survive difficult experiences. And most importantly, healing is possible. So not always instantly, not always easily, but genuinely possible, especially when people are met with compassion, safety, and support. So this image here says, "You are worthy of love." And that really captures the heart of this work for me. Mental health care isn't about fixing what's wrong with you. It's about remembering what's already right with you. And if any of today's conversation resonates or might even be triggering, I do want to gently encourage you to reach out for support, whether that's through a therapist, a healthcare provider, a campus resource, or someone you trust. You don't have to navigate these challenges on your own by yourself. I want to, again, thank you so much for being here and for your curiosity and interest in this treatment. And I'm happy to answer any questions you may have at this time.
Thank you so much, Dr. Gangi. I do actually see a couple of questions that came in. One of them is about the administering of ketamine, which I know you had on one of your slides. If you don't mind going back to that slide.
Sure. Mm-hmm. So there's several different techniques. One is a nasal spray, and that's typically done in a doctor's office, and you're monitored for about 2 hours afterwards to make sure that you're okay, and okay to leave the office. And you're not supposed to drive for about 2 hours after that. With the other treatments, the IV infusion, the intramuscular injection, the oral troches or lozenges, and the rapidly dissolving tablets, you're in the office and we typically have a 3-hour window in which that we're with you, and you do need to be dropped off, and you do need a ride home. And I personally walk people to their ride, and I'm in contact with their ride, and they're not supposed to drive for 12 hours afterwards, and I do a check-in later that day.
Thank you.
Sure.
The second question, can this be used in conjunction with ECT?
I know that it can be used in conjunction with transmagnetic stimulation, TMS, and it has some really robust outcomes. There's lots of research on that. ECT, I can't say off the top of my head if they pair well. But TMS and ECT are kind of a bit like a hop, skip, and a jump away from each other. So I would imagine that they do have pairings, but I wouldn't be able to say for sure.
And is this only for mood disorders, or does it also help with psychosis?
So psychosis is actually a contraindication for psychedelic medicine. So if the person has had prior incidences of psychosis, including bipolar, schizophrenia, as I mentioned, if the person already has had symptoms where they're struggling with reality testing, the psychedelic medicines are not well paired with as a treatment. Now, there are people that specialize in just working with that population. I am not one of them. And I would strongly encourage that if someone with that history, that they make sure they work with someone that is very well experienced with working with psychosis and psychedelic medicines.
Is this long-term treatment, and are there any side effects long-term?
So long-term, it's really dependent on certain people. I've had people go for years with not needing to come back for any boosters. It was that life-changing for them. They were able to heal a lot of some of the earlier phobias, traumas, experiences that still got in their way. Like I said, doing this along with therapy, you can get longer treatment outcomes. And, then there are some people who have struggled with, I guess, these are fewer and further between, but I have had one or two clients that have struggled with getting longer term treatment outcomes, and those particular people might have had some latent personality disorders that kind of came through the treatment that we suspect might have complicated the outcomes. And the other part of the question, can you repeat? Are there any long-term negative
Side effects?
So we always monitor for any bladder effects. We know that in drug abusing populations that take high quantities of ketamine over extended periods of time, that they can have cystitis, kidney cystitis, bladder complications, which means that they have an increased urgency to urinate. These things can remit, they can go away, but it is a complication that's known in the substance abusing populations, but much less so that occurs in the 6 sessions that are done at the doses that we do, which are typically less than the doses in the substance abuse populations.
I have a follow-up, I believe, to what you just said. So are personality disorders a contradiction?
I'd say it's a complication. I wouldn't say it's a contradiction. And I would say people with personality disorders need much more in-depth prep work and screening. We have to make sure that the person is properly resourced, that they have stability in their life. We don't want to have people that, again, are struggling with severe emotional instability. And so that's why it's very important to do proper screening beforehand.
You know what? I said the word wrong. It's contraindication, not contradiction.
It's kind of the same thing.
Okay.
Yeah.
Okay.
Yeah.
Okay, good. Okay.
Uh-huh.
Okay, so did you mention anything about pregnancy with like those who are pregnant with taking ketamine, or is that an issue, or is that
I would not recommend ketamine for a pregnant person.
okay?
And if anyone thinks that's possible, they should have a very thorough conversation with their gynecologist about that.
Okay. And finally, I think I'm going through all the questions. Finally, I believe you touched on this earlier, but if you want to add on to this, does ketamine therapy suppress traumatic memories, or does it help patients process them differently? And how durable are those effects over time?
Okay, that's a great question. No, I do not believe it suppresses. That hasn't been my experience, and that's not in my training. That's not been an issue. We always screen carefully for any of this beforehand. But if latent memories come up, because the ketamine and psychedelic medicines quiet the fear parts of the brain, the person is actually in a better situation nervous system wise for that complicated information to come up. And so the processing of it can be a lot more gentle and absolutely have long-term benefits for them. And that has occurred in this work that I've gone through, and the benefits have been life-changing for those people,
Okay.
in my experience.
And lastly, has it been effective in medication-resistant chronic depression?
Yes, it has. And some people do wind up tapering off their medications that they've been on for years. That's a case-by-case basis, but absolutely, even people with, 30 years of treatment-resistant depression can have very robust outcomes, and I've witnessed that and experienced that in my practice,
Oh,
which is
wonderful.
wonderful to see. Yeah, yeah.
Okay, well, I think we are almost up with time. Are there any last thoughts you would like to share?
Nothing really to add. Just if you're interested in this and you've got more questions for me, you can contact me at Dr. Gangi at drtracygangi.com. I'm happy to answer any of your questions. If you're interested in doing this work, I'd be happy to tell you more about it.
Well, thank you so much, Dr. Gangi. I really
Yeah.
appreciate the time that you've given us and the education. And thank you all for joining us today. And please have a wonderful rest of your day. Take care.
Thank you so much.
Bye.
Bye.